Okay. I realise that there may have been questions, etc., but we'll collate them and address them in future. It was a very powerful presentation and so many statistics, etc. I'll collate those as we go through, but I want to hand over to Megan because I don't want to lose out on the wisdom that Megan has planned to give us today. So Megan, thank you so much for waiting. I really, really appreciate it.
No, not at all. Well, thank you so much for the invite. Just want to echo what others have said, really, that it's been incredibly interesting and I've learned a great deal just by being here this evening. So yeah,
excellent. Thank you.
Thank you for
That's
letting me
great
come along.
feedback. Thank you for that, Megan.
Can I share my slides?
Yourself?
Yes, and can I share my slides? Am I able?
Yes,
have I got the power to do that?
That's absolutely, please do.
I'll just get those up. Okay, hopefully you can all see that on your screens. I'm assuming you can because nobody said no.
Yes.
Lovely, thank you. Thank you. So yes, my name is Megan Abbott. I'm a public health specialist and I'm based at Kent County Council. So I work in Dr. Anjan's team. Very, very, very privileged to work in his team. I would say my presentation is going to have a slightly different focus on what has already been spoken about this evening. For the last 6 years, I've worked in the suicide prevention programme within Kent and Medway. So I've been asked to come along this evening to talk a little bit about what that looks like in regards to our focus, our priority areas and some of our programme of works as well. So I think I've got about 15 minutes to hopefully run through that. So just a very quick note about self-care. This is something that we always put at the start of our presentations. I am going to be talking about suicide and suicide prevention for my presentation. Just a note to say that we obviously don't know each other's experiences with suicide. If any of this is triggering for yourselves, please do step away and look after yourselves. You can't pour from an empty cup, and we thoroughly believe in that. Need to look after yourself before you help others. So just a note about that. Okay, with that said, so we are responsible in the suicide prevention team for delivering the Kent and Medway suicide prevention strategy, and that's been in place since 2021. So we work to 7 different priority areas you can see on the circle, and I won't read them one by one, but essentially what that means is that we align our programme of works to those different priority areas. For those of you that follow or are interested in suicide prevention activity within the UK and kind of nationally, the Department of Health and Social Care published the new National Suicide Prevention Strategy for England towards the end of last year. That was still very much mirroring and aligning with our local strategy. So of course that meant we didn't need to kind of change a lot, but you can see that our strategy is coming to an end in 2025. So we'll be working to refresh and reflect some of the key changes. Just of note, particular at-risk groups that were added into the new National Suicide Prevention Strategy for England were autistic individuals and pregnant mothers, pregnant women and new mothers. There was also a couple of risk factors that were added, which I will come on to in a few slides' time as well. I'm going to talk about a couple of stats throughout this presentation. I think it's really important and something that the team and I always, I suppose, highlight extensively when we do these talks is that stats and numbers, particularly when we're talking about suicide, can feel quite dehumanizing. It's really important that we remember that each of these are an individual that has lost their lives in an extremely tragic circumstance, leaving behind loved ones. Mm-hmm. So this is a look at some ONS data, so Office for National Statistics data, and I'll come on to data in a little bit more depth later on. But we do use ONS data, and you can see there that Kent in particular has sat above the national average for quite some time. So Kent is that orange line, and you'll see from the time period from 2020 to 2021 that we were sitting at a 12.1 compared to the national average of 10.3. What's really important in public health and suicide prevention work in particular is that we look at rates per 100,000 population, but probably even more important is that we look at something called 3-year rolling rates. year-on-year fluctuations in suicides can be quite common and they can be quite misleading. So we always urge on the side of caution, I suppose, that if we suddenly see a downward trend, is that actually a trend, or is that just kind of a fluctuation that we would expect to see? But hopefully of interest to kind of see how we fare compared to the England average. Okay, so the majority of my presentation, I wanted to focus on some of our priorities and what we do within the programme. There's a nice picture of us at the top there. So we're a team of 4 and we do quite a lot, cover a lot of areas, and I'm not going to be able to touch on those all this evening. But we split our work programme very, very broadly in 2 senses. So firstly, by funding services and projects which look to reduce the risk of suicide and self-harm, but also promote mental health and well-being within our communities. And secondly, by providing what we call system leadership, research and quality improvement projects, which I'll be touching on throughout this presentation. So our first funded element is a social marketing campaign called Release the Pressure. So this is a 24-hour helpline and tech service. So Kent and Medway residents can access free and confidential support. They'll be signposted through to a trained counsellor, and that individual can listen and support them, and also signpost onto local relevant services that may help that individual. So the yellow social marketing campaign you can see here was really kind of where it originated from. We worked to co-produce this campaign with men in particular. Again, for those of you who know some suicide stats, will know that around 70 to 75% of all suicides take place in men. Middle-aged men in particular are a high-risk priority group for us. We co-produced the Release the Pressure campaign with men, for men, basically with them in mind, noting that we didn't want a campaign that labelled very explicitly mental health or suicide. Rather, you can see in the head, we have words that would resonate perhaps more strongly with them and encourage them to seek help. We've since kind of moved on with the campaign. You can see on the left-hand side that we've developed some subsequent Release the Pressure posters, for example, with the LGBTQ+ community as well. And I think what the social marketing campaign does is firstly, it's great because it's constant 24-hour support for Kent and Medway residents, but it also kind of starts a conversation around mental health and suicide prevention as well. Really proudly to say that we are currently in 3 of our Kent football stadiums, which is great because it's got a high footfall of men in particular, and women. There's definitely women that are fan of football as well. And we also kind of branch out into different areas where we might be able to utilise social marketing campaigning. So, for example, we've had the campaign on petrol pumps, knowing that kind of transportation and lorry drivers, that's a prime opportunity when they're filling up, and looking at kind of the petrol pumps as well. And we've just started to partner with some of our local coffee companies and developing coffee sleeves as well with a marketing campaign. So I think it's a really powerful asset, and we're certainly very lucky to have it. So the second funded element that we have within the programme is our suicide prevention and mental health training provided by Mid Kent Mind. You'll see the sentence that I've put there at the top. It's from the suicide prevention strategy for England, and it highlights that suicide prevention really should be everybody's business. And they believe that everybody up and down the country should have access to training. And it's something that we've had in place for the last 4 years or so in Kent and Medway. So Mind help us deliver 3 training packages: adult suicide prevention training, youth suicide prevention training, and everyday mental health training. So the everyday mental health training is a little bit more light touch. It looks at kind of common everyday life stresses and anxieties, and the 2 suicide prevention packages are a lot more in depth. They really equip professionals, but also general public, with the confidence, understanding and knowledge around suicide, how to have the conversation, how to ask the question, debunking myths, knowing that actually asking the question, are you having suicidal thoughts, does not put the idea in somebody's head. So really equipping individuals with the confidence to either escalate or de-escalate risk, and signpost onto local services as well. I think it's really important because it looks at certain language and terminology as well. For example, we try really hard to steer away from words like commit suicide. Suicide has not been illegal since 1961. So we would prefer terminology around took their own life, because that terminology around commit further perpetuates the stigma and the silence and the shame that we're really trying to move away from as a society, and something that we feel very passionately about in the team as well. Yeah. Excuse me. So our third funded element is suicide bereavement support, and that is delivered by an organisation called Amparo. So you can see there that that sentence at the top, there is a suggestion that individuals who are bereaved by suicide may have a risk of dying by suicide themselves that is up to 3 times higher. So for us, it's extremely important that individuals that are bereaved, when tragically a suicide does occur, they have access to timely and effective support. There was some research that suggested around 135 people were affected by any one suicide. I would suggest that that figure is likely to be a lot higher, which I think really exemplifies why Amparo and services like themselves are so crucial to have in place. And Amparo is free to access for all Kent and Medway residents. They provide emotional support, so in those early days, kind of hand-holding, but also practical support, so dealing with the police, navigating the coroner inquests, dealing with the media if it's a particularly high-profile case as well. And just to give an example, they will also run what we call community response plans. So if there has been a suicide within a school, for example, they're able to provide that support around the peers, the teachers, the individuals that work within the school. And they've recently branched out to our Sikh community locally. They got in touch with me and had noticed that there had been several suicides over the last couple of years and were really keen to have some support. So Amparo have actively gone in and provided some community response plans with the Sikh community, ensuring that they are culturally competent, and they're looking at how that can influence their service kind of going forward and how they might be able to support other communities as well. So moving on to the system leadership elements of our programme, we have something called a real-time suicide surveillance data set, and I'll call it RTS for short because it's a little bit of a mouthful. So prior to having our RTS in place, and our RTS came into place in 2020, we would rely heavily on the Office for National Statistics to understand basic numbers, quantitative information around just how many people were dying in Kent and Medway from suicide. That, of course, isn't particularly helpful when you work in public health and you want to implement preventative activities and interventions. So I was tasked with the job, probably back in 2019, to listen to about 200 hours worth of coroner inquests, which allowed us to have an understanding of what was happening to an individual prior to them taking their own life. Both aren't particularly good data sources when you're wanting to influence your programme of works. And in terms of the coroner inquests, listening to them is very resource intensive and quite upsetting, to be quite frank. So having our RTS in place has been game-changing really for the programme. So what it is we receive suspected suicides on a fortnightly basis from our partners over at Kent Police. It allows us to do 2 things. It allows us to monitor any trends or any concerns kind of around cohorts, location, demographics, and allows us to implement proactive measures or escalate kind of as and when required. And it also allows us to look at particular risk factors. So we've heard a couple this evening. We can look at risk factors around domestic abuse, financial difficulties, if that individual had a relationship breakdown or a recent divorce, housing problems, for example, no access to their children. And we can drill down into those and really understand what was happening to an individual prior to them taking their own life. And that allows us to influence our programme as a result. I just pulled this off because I thought it was quite interesting. So we're always very careful with our RTS data. It is sensitive data, but I wanted to share this just to give the example of how multifactorial suicide is. It is very rarely down to one risk factor, and you can see here the complexities in individuals' lives as well. And yes, I think I just kind of wanted to put the point across around the societal pressures and the difficulties kind of in individuals' lives that we really try within the programme to have an effect on and an impact on. So one example around a risk factor that we have worked extremely hard on is domestic abuse and the links between domestic abuse and suicide. So just to give a little bit of context and background to this, since kind of 2020, we have been advocating on a regional and national basis to seek change, essentially, within the DA and suicide world. Our RTS highlighted that around 30% of all of our suspected suicides had been impacted by domestic abuse. And that relates to whether the individual had been a victim, a perpetrator, a child or young person living within a household. And we worked extremely hard with Kent Police to refine that data. And as I said, we've continued to advocate for it. And you can see we're proud to see that within the new National Suicide Prevention Strategy for England, they've highlighted domestic abuse as a risk factor for the very first time and referenced our programme's work directly as well. You'll see the purple rectangle there. We have developed a number of briefing papers for frontline professionals, and I'm very happy for those to be shared with this group. So we've developed one around domestic abuse and suicide. We've developed a second around autistic individuals and suicide. We also have some that focus on children and young people, particularly around the care levers and neurodivergent as well. So what they do is really equip frontline professionals with the findings that we have undertaken, but then some real practical implications for practice as well that they can take away into their working lives or personal lives. Just a couple of slides left from me as I'm aware of time. So probably one of our other biggest things that we do around quality improvement, sharing best practice and system leadership is all of these avenues essentially. So we have an annual conference, which we held this week on Tuesday. Hence why I'm a little bit tired, because that was it was a very busy day, but it was a great day. So we had about 200 delegates all together at Detling, if anybody knows Kent well, multi-agency professionals all coming together, lived experience as well, a real great opportunity for us to share best practice. We also are responsible for 3 quarterly network meetings as well, where we do similar. We look at kind of local, regional and national best practice, what's happening. And it's just a fantastic forum for multi-agency partners to come together who are working to prevent suicides and self-harm within Kent and Medway, but also increase the mental health and wellbeing within our Kent and Medway residents as well. And we have a monthly newsletter, which kind of keeps everybody up to date with what we're doing and what latest research is as well. So I can pop our team's email in the chat, and if anybody is interested in coming along or signing up to the newsletter, you'd be more than welcome. My last slide is just this really. So it's a very challenging and sensitive topic. I've worked in it for the last 6 years. Very lucky that we're a very close-knit and supportive team, but something that we do a lot and have started to hone in on in particular is messages about hope. And within our conference on Tuesday, we asked our delegates to write some notes around what hope meant to them. And I think it can be really powerful, especially in this working in this forum. I think it's only going to take kind of us all working together collaboratively, as we've heard in lots of different ways this evening, to make real strides in suicide prevention. We know that we can't achieve this by ourselves. We need the efforts of everybody together, and that's how we'll make change. And that's all from me. Thank you.
Wow, thank you so much. Thank you so much, Megan. That's really, really interesting. And I'm very grateful for your timekeeping, but I felt that we rushed you, and I apologise for that. Some really interesting facts there. One of the things that for me is really is key is that I'm fully aware that it used to be very much along the younger men, and I see that there's been a shift to that middle-aged group, but it's still seen as very much, I think, a white issue. Would you be able to address that for me? Seeing as this is about the GEMS community, have you started using GEMS yet in public health?
No, so I will be honest, it's the first time that I've heard of it this evening, so it's definitely something that I will take away. Yeah,
so it's because it completely changes the context, doesn't it? It changes how it's presented. So the global ethnic majority, yes,
absolutely.
So is there anything at all in terms of the Black community that you want to highlight?
I think one of my frustrations, and some colleagues on the call may be able to expand a bit more, but when we look at things like our real-time suspected suicide data and sometimes on the ONS data, it's not something that I think is particularly that well recorded. So I think that can be really difficult then, because we don't feel like we're getting an accurate picture. And of course, that's something that is out of our powers, and not something that we can do a lot about. But I do think it's a lot around kind of under recording, inaccuracy in recording, and I think that's something that we really need to improve on, because without kind of knowing that, as I said, it's then very difficult for us to make change.
So is that would you say that that's definitely a structural issue in terms of it not being reported properly? Are there any, I ask this openly and particularly to all of the participants, are there any myths? Is the issue of shame, is it any different in the Black community to the white community? I know, for example, for those that come from a very rigid Catholic background, the shame is beyond belief. And it depends on, religion, culture. There's a whole range of things that come with that.
Absolutely. I think it's really difficult to put it down to any one thing. When we were working really closely with the coroners, and actually the change in the recording around that in the coroners is something that we're really pushing for and have been pushing for quite a while. But just in terms of the example that you gave there, and this isn't just in relation to this community, it can
Sure.
be quite widely felt in terms of if there is a family in particular and the coroner can sense that they are going to be more distressed or upset with a conclusion of suicide, they may rule it as something like a narrative or an open verdict, which again can make it difficult to really get an accurate representation of what is happening. But of course the coroner is trying to do their job and make it a very traumatic and upsetting time, perhaps slightly easier for the family, because that conclusion may be even more devastating. So it's very difficult. So
there are structural negatives and positives there, really. But yes, it's concerning. And I think one of the things that I picked up from you is what's important is the language and the language that you use. But also the networks that you access. So I thought it was a brilliant idea. Garages, when you're filling up petrol and you've got signs, etc., that you can see there. Where is it that men go that they will see it, where they don't feel targeted?
It's definitely about trying to be smart, so it's not kind of shoved in their face, but it's there if they need it. And I think actually the Release the Pressure campaign has been going for the last 10 years. It's quite well known now within the county. It's a very distinctive kind of imagery. People get it, people know what it is. I think what we could do is perhaps co-produce some of the Release the Pressure campaigns with some other communities. It's something that I'm quite interested in doing next year. Very open to kind of any ideas, or if people do want to get in touch.
I think we would be delighted to offer anything that we could to that. I think that would be an excellent idea.
Grand. I'll pop my email and the team's email in the chat as well, and just want to reiterate my thanks for letting me come along this evening. And
we're delighted. Thank you.
Hope to be in touch and work with some of you in the future. Thank you.
Thank you very much, Megan. Thank you. Because of time, and I know that Megan also needs to leave, we will collate any questions, etc., and we've got Megan's contact details. But it's something that we deal with regularly within public health, and certainly families are devastated by suicide, particularly when they've absolutely no idea. And you will have seen on the news, it devastates entire families. Clearly, from a parent's point of view, appalling. From a wife, from a family, it leaves orphans. There's a whole range of things, and it's very difficult to address because of the myths and the stigma that still surround it. But we do need to be able to capture better data within the context of that, and I think it would be fabulous if we can work with Megan with respect to so what can we do differently to ensure that we engage different communities. I think that would be excellent. So thank you very, very much indeed.